Hey guys, welcome to the CPD Junkie Podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and today we are joined by Dr David Bassal. He completed his dental degree at Griffith University in 2010, currently owns and operates Warnervale Dental and Mingara Dental and Implant Centre. He's also co-founder of Australasian Implant Academy and co-founder of the Australian Dental and Implant Group, now with 10 dental surgeries. He has dedicated his continuing education specifically in the fields of cosmetic smile makeovers and full mouth rehabilitation. Dr. David Bassal, welcome to the show.
Thanks for having me on, mate. Thank you so much.
So, tell us about your dental journey to get to where you are today.
So, graduated from Griffith University on the Gold Coast there. It was a good time. Came back to Sydney and, I worked in a number of practices all over Sydney and in Wollongong. The first job I landed was a job that I stayed in for about 7 years, and I owe that to the mentor that I had. First, it was actually the first interview I went to. And I guess it was just a perfect match. And, that practice, Dr. Robbie Semi, he was my mentor for a very, very long time, obviously. And, I guess that's kind of where my dental journey all began. I moved around. So I did, part-time work there, and I moved around, spending maybe 3-4 days at Finesse Dental and then a few other days and a couple other practices, mainly for the sole, the sole idea that I would find the area and the practice kind of atmosphere that would suit me, and just experience kind of thing. That's all it was. So I went through about 7 or 8 different practices at that time with that second job, and I worked in Wollongong in like rural settings and things like that, where I got a lot of volume. Yeah, that's kind of where I sped up. And I learned how to use my hands. The dexterity was there because the volume was there. I found that was really important. Going outside of Sydney and going to a practice with a high volume of patients, because of, I know it's a lot harder to find that kind of stuff today, but trying to move out of, I guess what they call the rat race and see if you can see as many patients as possible. And if that means traveling an hour and a half, well, that's what I did. And from there, basically, about 7-8 years in, I thought it was time. I opened up my own practice. I met a gentleman by the name of Ned Reston in an implant course at the Brenner course, and we had a few conversations. Ned's well known in the dental society, and he's opened up a few practices himself, and so I got his take on practice ownership. What's it look like, the numbers, showed him a few practices, and that's when he propositioned me with coming up to the Central Coast. And I haven't looked back since. We formed a group recently, the Australian Dental and Implant Group, and at the moment 10 practices strong, and I've opened 2 of the surgeries, Mingara Dental and Implant Centre and Warnervale Dental. Been running Mingara for about a year now. We're doing really well there, and Warnervale Dental for about 4 years, and that's pretty much brought me to today. A lot of ups and downs, and you take every experience as a learning experience, and I wouldn't change a thing. So it's been great.
So let's backtrack a little bit. So you obviously, when you decided to pick your practice, you decided to find somewhere that was away from the metropolitan of Sydney. And you wanted to find a practice that was quite busy so you could get your hands wet, basically. So you mentioned, was it Dr. Robbie Semi, was it, right?
That's correct.
At Finesse Dental at the time. What did you kind of learn, and how did you choose your CPDs?
So Robbie was actually the practice, he was in Stanhope Gardens, and he, that was in metropolitan Sydney, but that's where I learned kind of the intricate stuff. So I started off with some quick ortho. If you know about in-man aligner and quick braces and things like that. So that's where I started. And I did my first, complex rehab there, like building up with crowns and composites and things like that. I did a lot of the more complex stuff there. However, I had another job for a number of years where it was outside of metropolitan Sydney, like you said. Mm-hmm. And that's where I saw the volume. When I graduated, there was a lot of EPC patients. You're seeing, 10, 12, 15 patients a day as a graduate. Mm-hmm. And nothing complex by any means. The most complex thing I did was root canals, but the volume was there. And I guess that, regurgitation and repetition, not sitting around and waiting for someone to come through the door. Yeah. That was so important. So important to learn how to, manage my time. Yeah. Obviously, the more you do, the more mistakes you make. And we all know that's the only way you learn, particularly as a graduate. Funnily enough, being outside of Sydney, I feel like the patients are a little bit more forgiving. So your patients that are I guess Wollongong's no longer considered a rule, but when I was there, patients were a little bit more forgiving, a little bit easier to get through. They didn't have time frames where they were, I'm running late, hurry up and finish. As a graduate, you're a little bit if things went wrong, we'd fix them and there wouldn't be any problems.
I just want to come back to, so when you're working for Dr. Robbie, you mentioned you were learning about some ortho as well at the time. Talk to me, because he does a few things, right? I know he's is he a KOL speaker for, was it implants as well? Yeah.
So Robbie Semi's, he was a great mentor, particularly when it came to ortho. That was...
Did you pick weekend courses? How did you kind of pick them? Was he directing you to pick these, or did you go and find it out yourself? Or?
That's pretty much what it was. Just hanging off kind of someone else's kind of experience as far as what courses to go to. Look, I quickly found out that ortho wasn't for me. So even though I learned a lot from Robbie, and in that practice, I found that, that's just not what I was after. And I quickly found out from making mistakes as well, that you don't know what case not to touch until you've touched it sometimes. And in a world where you're learning from your mistakes, you want to try to avoid that as much as possible in dentistry. So kind of held back off that. And kind of watched from afar after that, and just kind of made my way out of orthodontics and more into complex rehabilitation and occlusion, as far as building up teeth and implants and stuff like that, which is...
I want to ask as well, with orthodontics at the time, so you were doing these weekend courses that you were recommended by one of your mentors. And then you were progressing through it. Were you doing more orthodontic CPD as you were going? Some people would say, they opted to do a structured course, a modular course to approach it. Was that something that crossed your mind, or was you just started to feel like that wasn't where you wanted to go?
Yeah, look, in hindsight, if you're going to do something, do it properly. It's like learning how to, I guess, doggy paddle and then jump into the ocean. It's not the right thing to do. You become overwhelmed really quickly, and if you're going to do something, you need to do these longer courses and really take in all the information from the experts, so that when you do come across a case, you enjoy it. You're not overwhelmed. You've learned all the right things and tips and tricks, and so it becomes the actual orthodontics that you should be doing, not the stuff that you thought you should be doing. So, the weekend courses, I would probably say, maybe to get a little bit of an idea, it's okay. But if you really want to start treating cases like that, really, going into the whole, things like Derek Mahoney's course, I've heard great things about that from a few of our associates and things like that. Those are the things that you want to be doing over a couple of years.
And that's how you felt after going down that path, is that right? Yeah. And then you just felt like you just wasn't something that you wanted to do when you're tackling the cases and all of that, and that's why you didn't pursue it further.
That's right. And it could be a matter of, maybe if I did the proper courses, I would have been in a different position. Maybe I would have loved the ortho a little bit more. But I probably bit off more than I can chew. Look, I mean, at the end of the day, everything kind of went fine. I had a mentor that was behind my back, helping me fix any issues that may have arisen. So everything ended well there, but it kind of turned me off the whole thing. And so I took a step back and thought, okay, well, if I'm going to look at doing something, let's do it properly. Let's get the hands-on experience. Let's get the whole modular course like you're mentioning. That's pretty much where I'm at when it comes to education now.
Hey guys, it's Laurence here. Want a few tips on how to improve your interior composite restorations to make them all so nice? Well, we've got an exclusive CPD Junkie cheat sheet collab with Dr. Laurence Doan. You'll get the essential tools to set you up for success, an exclusive promo code for the Hugh Freddy School Tools Composite Sculpting Kit, and a step-by-step case presentation. So head over to cpdjunkie.com.au/aesthetic cheat sheet / to download your free copy today and make those bomb-ass anterior restorations. So yeah, tell me about how you kind of progressed with your cosmetic smile makeovers. How did you build your CPD towards that, or was it more just you were doing it every day?
It's actually more that I was doing it every day. And it was more that, and it particularly happened when I came up to the Central Coast. So owning my own practice obviously gave me a larger scope of patients. So all the patients that came in saw me first pretty much as you being the sole operator in a practice. And so, it just happened that way that I took a liking to smile makeovers, and I eventually found that that's what gave me, I guess, the joy in dentistry that we're all kind of looking for from our 9 to 5. And I pursued that actively by attracting the right kind of patients. As a business owner, I take it from a different perspective, and that was kind of the marketing behind it to attract the patients and kind of create the image or persona of a practice that really deals with that kind of stuff more than anything kind of. So the makeovers, and then just from experience, using different companies, digital companies like DSD, using certain labs, and then starting to do some online courses from there. That's kind of how my makeover specialty came in.
Yeah, well, talk to me about these online courses that you were doing that you were kind of build, because for a lot of graduates, they're thinking, I'm doing these single one cases, or maybe like a bridge, something like that. And then it's, how do they progress to that point where they do, a full mouth rehab in your case? So
I feel like, look, to be completely honest, I feel like DSDs, they've got some really, really great material. And that's what I followed. And it's pretty much, once you do, particularly with the cosmetic stuff, maybe not the functional rehabilitation, but with the cosmetic stuff, we're talking about veneers and things like that. I always tell my patients that I get a perfect result every time when it comes to cosmetics, because they have a say in it, basically. So you're able to try a smile in, and the patient has their say. And so I'm basically selling this as the perfect smile for the patient because the patient has chosen it. And it's basically a cookie cutter when it comes to the cosmetic stuff. So their online courses really kind of broke down, how you look at teeth and smiles together. And that's a very subjective thing. And so it's very hard to get that right. But when you factor in the fact that a patient has something to do with that, well, then you can't get it wrong, right?
Yeah.
So that's how that went. Yeah.
I mean, when we talk about DSD, we're talking about, a Dr. Chris Coachman. Yep. He kind of brought that in fairly recently. I mean, prior to that, are you saying that you were already taking photos, you were trying to wax up and with the technician and all of that? That's what you mean? And then now, it's just termed the DSD, but that's what you're kind of already doing.
That's exactly right. It just streamlined everything, right? Their PDF files that they send through, the breakdown of exactly what to do to every single tooth for pre and post models and things like that. And it's just the ease with which you can upload and download cases. It just became so much easier for me. And so,
so you were kind of already doing that, but DSD just helped made it streamline.
Definitely. Right photos every single time, the right angles, having that camera set up in the practice and all the rest. It just became, so easy. I mean, my dental assistants are now taking photos, doing all the scans and uploading the cases now. So, super, super straightforward.
Fair enough. So you also mentioned, back in your early days, you were doing a lot of root canals. You had a couple of failures here and there. Did that compel you to do more root canal CPD, or it was just?
Yeah, definitely. With the root canals, I found a mentor in James Whelan. So there's endodontic specialists are the guys that you want to be talking to when it comes to this stuff.
Sure.
So I ended up doing a hell of a lot of emergency treatment. And I found a real liking to that. Getting patients out of pain, there's definitely some satisfaction to that, right? And so I found myself doing more and more root canals. I snapped my fair share of files, obviously, we all do, and I've sent them off to endodontists and things like that. But I found mentorship with a specialist was the way to go with that. There's always new materials, bioceramic sealers, the right kind of irrigation that you want to be using and things like that. And that's where I found, my education, just bouncing off cases from an endodontist and saying, is this worth treating? Is this worth, going surgical and referring off? So that's where, that happened.
Right. So now talking about implants, so that's a big part of your what you do today. How did you kind of build yourself towards that?
Yeah, so again, moving up to the Central Coast, the demographic up here is, your veteran patients, they're a lot older, particularly in the suburbs that we've opened up. And so there's a lot of missing teeth and cracked amalgam teeth and things like that. The other thing is the need was quite high because there weren't many implant patients, dentists here. And I took a liking to surgical. And again, with Dr. Ned Reston, we found that, Dr. Ned Reston does implants day in, day out. And I watched a lot of implant surgery with him. And so one by one, I started with guided surgery with the Dio brand. And, did my fair share of that. And then eventually got into the full arch stuff, which I'm doing now under GA in Brisbane Water Private Hospital. So the way that began was at the Brenner Implant Institute. I had done some weekend courses and things like that. And again, but surgery is a different beast, right? You don't want to be opening someone up unless you know what to do if something goes wrong. So I did the weekend courses, but never placed an implant. Didn't even restore one. You just never got that confidence and that backing to say, okay, well, let's do this, right? So I was like, okay, well, what do I have to do? And, on the guidance of Dr. Ned, we found, first of all, I went to the Brenner Implant Institute, which is a modular course done over 8 or 9 weeks. And the thing that attracted me to that was the fact that you could bring in patients and do live surgery and practice with Dan Brenner by your side. So that was good. I felt like off a course like that, I probably didn't get enough hands-on. I wanted to do a little bit more. Came out, did a couple of implants, but probably not enough for me. And so on the advice of Ned Reston, we found a course in the States by Dr. Louis Alfarage, who runs the Californian Implant Institute. And that was my game changer. I think that was probably the biggest game changer as far as my career goes. And that was because that was an intensive week of placing implants. So you're off in Mexico, a beautiful part of the world. And, every single day for 5 days, you're just popping implants into patients. So the day would usually start, day one was a lecture day. And then the day would usually start with case presentations. And once we've done the case presentations for every single case, off you go. It was an 8-chair clinic. You and your partner would pair up with a patient. Obviously, there were clinical tutors everywhere. And we're banging implants left, right, and center. I placed, 20, 30 implants in a week.
Right.
And that's what you need to do. That's, mistakes happened, obviously, as far as, incorrect angulation, but everything was being ticked off. So you'll say, okay, well, I'm not going to make that mistake again. And you need to be able to do that over and over again to walk out of there, with the backbone to be able to, take it back into your own private practice. one of the biggest things as part of that course was an app called Novodontics.
Mm-hmm.
And this Novodontics app is a way by which you can reach out to a mentor. So you pay a small fee, upload a case, upload all your photos, reach out to the mentor of your choosing. There's a list to pick from, and they'll do basically a 45-minute interview with you and basically plan the case out for you. So I think, I did that religiously, and I told myself, I'll probably do as many as I can in the first couple of years. And I got up to 50 cases with mentorship on implants. And
Mm-hmm.
even if I knew, okay, this is a simple case, it's a slam dunk implant, there was always something that I'd learned. And so I dedicated myself to uploading every single case for the first 50 cases, literally. I made that my goal, and I learned a hell of a lot on cases that I didn't think I would ever learn. So we're talking about, the intricacies of soft tissue and things like that,
yeah.
For a lot of dentists is probably the final frontier. We place the implants and then, okay, what do we do next, right?
Mm-hmm.
And so they always say soft tissue is the issue, and that's where I learned a lot about that. And that's kind of where I'm trying to progress myself now is, how do we work on that the intricacies of implant surgery, which is that soft tissue, because anyone can place an implant in bone, but how do you make it work for a long time?
Right. Yeah. And how did you come across this, the California Implant Institute? Because that's not commonly known around here in Australia.
It was actually, Ned had some friends over in the States, and he's obviously told me about it. The first course I did was a course called trefoil.
Mm-hmm.
I think it's an outdated method these days, but it's 3 implants and a full arch on 3 implants. This has got to be a certain width and length of implant. Mm-hmm. But I did about 4 cases of that, and then after that went and did the full arch. So all on 4, or what we call here teeth on implants course, and with the prosthetic and everything. So that was the next course I did, and there was a few didactic theory courses over there.
Right. So basically, you started out with the weekend courses. You felt like that wasn't quite enough. And then, so that compelled you to do the Brenner Implant Institute course, and that kind of felt a lot more comfortable for yourself, build confidence for yourself, because it allowed the live patient aspect, so you could start applying it. And then that progressed to the California Implant Institute, where you could do a lot more high volume and feel a lot more comfortable in your skills. And then, is that how? And then you were still doing single cases at that time, is that right?
Yeah. Still doing single cases, yeah.
Yeah, and then from there, you said that from there to where you are now, you transitioned through a phase where you were doing 3 and then 4 implants, an arch. Is that how it kind of came along?
Yeah. I mean, a lot of at the beginning, still after some of those courses was, particularly the Dan Brenner course, was still guided implant surgery. There's a lot of things that, you don't place enough implants in some of these courses, so it was still guided. It wasn't until I did the freehand volume in the CII that really, I came home and said, okay, let's do this.
Yeah. And then from there, how did you progress towards the full mouth one, you were saying? So
it was just a bunch of courses over there. So I was back and forth to Mexico, which, it was, a lot of fun.
So it was a subset of that implant institute.
So there's several different courses that you do. So there's actually a mastership course, which is 1,000 CE, a bunch of externships. So there was grafting and things, advanced grafting courses, single implant placement, full arch implant placement, all that kind of stuff. So there's a full scope of work. So it wasn't just one week of implants. Yeah.
Sure. Yeah. I mean, because, for a lot of graduates, they're thinking there's so much content, there's so much noise out there. How do I decide to choose, your content or the courses that you pick, right? Because it's expensive. It's not, when you're flying over for a weekend, you've got the flights, you've got accommodation, you've got, the course itself, you're taking time off work. Like, these are a lot of things to kind of consider. So how would you kind of frame it for them when you're...
Yeah, look, this is a segue into the AIA, I guess. I mean, this is what we identified. the Australasian Implant Academy was born of that, you know, trying to travel overseas to get this stuff done. And like you said, accommodation and flights and all that kind of stuff is, you know, just an extra burden. Time off work, obviously, we've got to take that into consideration. So there was no course doing what the CII was doing here in Australia. And so that's where the AIA was born. And it's basically a course that myself, Ned Reston, Dean Lysenbach have put together. And what we're doing now is doing live externships here in Australia, and we're running them out of Warnervale Dental, Mingara Dental and Implant Centre, and Avoca Beach Dental. So we are 3 or 4 different weeks, so 3 or 4 different subsets. So you've got single implants, single and intermediate. Then you've got your advanced implants. So we're talking about cosmetic implants, so in the anterior region, or we're talking about immediate implants, maybe thinner ridges, more difficult implants. And then we've got the advanced bone grafting. So we're talking about, you know, thickness grafts, block grafts, sinus grafts, things like that. And then finally the full arch, which is actually being run out of general anesthetics at Brisbane Water Private. So this right here is a course that will take you from your beginning of your implant journey to the end. You can do it all together. So you can opt in to have all the course, register for the entire course and do it all together. But like you said, it can be costly for a graduate. So the other option is to have 1 week at a time. And obviously each week has its own didactic or theory program attached to it. So for a week, you're learning the theory, and then you're going ahead and placing you're placing around 8 implants per clinician, and assisting with 8 implants to start with, then with the bone grafts, you know, 2 or 3, and assisting with 2 or 3, and so on and so forth. That's what you need. And it doesn't end there. The same way I had Dr. Louis Alfaraj sit on these phone calls, just like you and me are sitting on Zoom with an x-ray in front of us, going through every single case. And we went through, like I said, 50 cases. We have the same kind of mentorship that comes with our course in order to make sure that, you know, you're not going off and doing this by yourself. There's always something that you can learn off, even what you might think is the most simple case. So taking your hand after the fact in the real world is really, really important. I don't think you can put a value on having a mentor. So.
Fair enough. So yeah, a lot of graduates are at that 4-5 year mark. They start to contemplate, you know, practice ownership, being a specialist, being a super GP. Can you share your thoughts on that?
It's a tricky one, and I guess it's a very subjective thing, you know. Some people are good at business, and some people just aren't made for it. And you know, some clinicians are just better as clinicians. I mean, you got to think of dentistry as being married, and then once you have a practice, it's your baby, and it can complicate things. It can complicate things for the marriage and make it really, really difficult for you to do good dentistry when you've got this crying baby in the background all the time. So you've got to really think about, am I at the stage clinically to take on the extra stress of dealing with staff and running a business? That's probably the biggest question. Do I have the support structure, the right accountant, the right people are behind me to put me in the right place? Do I have a business mentor? That's super important. You know, there's certain ins and outs of running a business and the intricacies of that are, you know, too hard to learn in a course. And as, you know, things change, you know, government handouts change and things change, like COVID's thrown a real curveball at us. How do you survive these times as a business owner? So yeah. That's something that you really need to be prepared for. And look, you will learn it, but you definitely need your clinical skills up to date, because the last thing you want to do is open up a practice and then refer everything out. You know, where's the sense in that? Yeah. So there's that. As far as, I guess as far as opening a surgery, I think you need to be confident in your clinical skills. And probably even at the stage where you're confident to help out an associate. Because you want this practice to be open. You can't work every single day, so you're going to need someone there and who's that person, and are you going to be there to support them as well? So I feel like in my journey, 7-8 years into it, I had a good eye for everything. And even though I opened up my own surgery, I was still working as an associate somewhere else. And that was super important. That transition phase was super important. You're opening up a surgery, the income kind of drops a little bit, which can add to the stress. And so you want that second source of income. And of course you want to be still attached to other dentists, because it can be a really, really lonely time. So that's my idea. As far as being a super dentist, I'm not one, so I don't know about that, but I guess, some people prefer to stay to stick to studying and become specialists, and I admire that.
Right, yeah. So like you mentioned, so a lot of the things graduates need to consider is, their partner, how it works within their own personal space. And you said setting yourself up for the right kind of the support network around you, whether it be, because a lot of graduates obviously don't have a business background, they come out just as a clinician. And so what you've set yourself is set yourself up with a business mentor. And that, are you saying that from like the people that you've been interacting with from the jobs that you're at, or did you look externally for these kind of people? Or?
Look, I'm a firm believer, if you look hard enough, you'll find it. And if you put your energy into something, it will come. And so just dedicating yourself to opening up a practice and looking around and asking. I mean, for me, it was, asking a guy that already owns 6 practices, saying, okay, well, here's the numbers. What do you think? And that's kind of where I was given better direction. We've now formed the Australian Dental and Implant Group, which a new way of looking at dentistry as far as business ownership. And this was born of that. I mean, you can run the practice as a really good clinical operator, or you can run it as someone that's really business minded. But doing both of them really well is very, very difficult. And so the Australian Dental and Implant Group is a group that we've formed where the clinical side is taken care by, for example, the dentist, the principal dentist, and we now manage the practice for the dentist, so they don't have to really worry about the marketing, the tax side of things, hiring staff, the HR nightmares that come with owning a business. And we're growing at a pace that really, I guess, mirrors the success of what we're doing. So we've got a number of surgeries where principals are running the practice exactly like they want. It's, everyone has a dream of what their surgery is going to look like, but at the end of the day, how to run it, most people don't have an idea. So that's where the Australian Dental and Implant Group does come in. So that's our solution to that problem.
Right, yeah. So just kind of reducing the amount of all the non-clinical side of things down, so you can focus on what you're passionate about, which is more clinical side of dentistry. Yeah.
Let's be honest. I mean, we could all be great dentists, but I mean, how many of us are going to be really good business owners, or run a business properly? Like you said, we've got degrees in dentistry, not business. So I think we should be sticking to what we're good at and dedicating ourselves and our time to that, because there's a lot more power in that, and the return on investment in that is going to be a lot higher. And then handing off the stuff like running a business and hiring staff and things like that to someone else.
Yeah. So I want to come back to CPD. Yeah, mate, you've done a fair few bit of the CPD. How do you get the most out of your CPD?
In the past, I didn't. In the past, I was like, I'm just going to try this and see what happens. These days, if I'm going to learn something, I've got a whole bunch of patients that are ready to go. So the most important thing is practicing as soon as you get out of that class. Otherwise, it's gone with the wind, right? It's never coming back. And you kind of it gives you a false sense of like, I'm not good at this because you haven't done it. It's just, well, I haven't done it. So the first thing I do when I pick a course is I've got the patients, and I think about my courses now as a business owner as well, I think about my course in a little bit more detail. I have a plan, so to speak, to improve my practice and improve my skills. So I see or I identify things in or holes in my clinical day to day, or in my practice itself, and say, okay, well, this is what I need next, and these are the priorities. And I guess asking people, friends that have done the course is obviously super important. We're always going to start with that. And seeing how long the course has been around for, and the people that are teaching it, and probably following them a little bit more closely before I go ahead and take that leap. But definitely coming out of it, I hit the ground running.
Yeah. Just to make sure you have some patients lined up if you're going to be planning on taking a particular CPD to get the most out of it.
For sure. Yeah, for sure.
So
even when you're sitting in a course and you're like, okay, well, I've already assessed these patients, and you're already, drawing your similarities between what you've seen on this patient and now what you see in front of you in the course.
So you've mentioned Dr. Robbie as someone who's been pivotal in your career, and why is that? And if there's anyone else, why is that?
Look, I think your first kind of mentor out of uni is super important. I guess they can make or break you, because look, let's face it, at the end of the day, uni's great, but everyday dentistry and dentistry in private practice particularly is a lot different to what we were all taught at uni, or at least what I was taught at uni. So yeah, that was why I guess I got a good foundation of everything after in my first 7 years. But from then on, really growing and taking it to the next level. I found a good friend and mentor in Ned Reston, and I think there's a lot of things that go with that. As far as how to deal with the stresses of dentistry is a big thing. You want to be learning from someone else's mistakes, because like I said, in a world where you learn from your mistakes, it's probably best not to have that happen in your clinic. So if you can have it, learn from someone else that's done them, you're always better off. And someone that's, I guess, honest and very critical of themselves, to say, okay, this is what I did and I messed up here, or I did this here, or this didn't go right for me there, and this is the way I fixed this problem or done this. That's exactly what I find or admire in a mentor. So there was that side of it, and of course for me the surgical and clinical side of it, just someone that's well aligned with what I want from dentistry. So someone that has the same kind of views or perspective of what their day to day would be.
Yeah. So kind of aligning just so when you're talking about trying to find an early mentor, it's crucial that their philosophy aligns with what you hope your kind of philosophy should be. Yeah. So talk about that mentoring. A lot of graduates want mentoring. They interpret it differently. Some people like to be held by the hand. Some people like to be checked in once in a while. Some people just learn by observing. What's your thoughts on recent graduates looking for mentoring?
Yeah, you couldn't put a price on it. I mean, courses are great, but there's always questions after the fact, and there's got to be someone that you can ask. So either the person that runs the course. You've got to be able to go back to these people, because in writing, it's all well and good, and in a textbook it all looks great, but I mean in the real world these things sometimes just don't add up. So having someone to go by and case by case, and building that armamentarium where you've done a few of these different cases and gone back and asked someone is super important. Now, as far as how you want to be mentored, I guess to each their own. But the more you put in, the more you get out, right? So, the more you're in touch with someone that's going to show you the ropes, it's definitely more that you're going to get out. So as far as being a fly on the wall, I think I'd probably invest myself a little bit more into someone with a little bit more experience, and kind of humble myself and really kind of follow that person if I want to be great like them, for example. Otherwise, you'll end up just staying a fly on the wall.
Yeah, fair enough. And so, like you said, learning it from other people's mistakes. Talk about, any struggles that you've had in your CPD dental journey so far, and some of our viewers might not know about.
Look, I mean, I guess it was the ortho stuff at the beginning for me. Just maybe not. I didn't get into it as much as I probably should have. If I wanted to be doing that seriously. So I guess, but I learned my lesson early on. I learned my lesson, and I made some changes. So now if I'm into something, it's head first, dive all the way in, get everything I can out of it before I make a judgment of whether I like this or not, or before I make a judgment of whether I'm good at it or not, whether I suck or not. So I'm definitely, even if I'm into something, halfway, and I'm thinking, I don't know about this, I don't stop and quit halfway. I go the whole way through, because there might be something that might say, okay, maybe I do like this. So you've kind of, and look, there's plenty of time for it too, right? I mean, what's the longest course? A year, 2 years, 3 years? So what? We're all working for a long time. So, and after a while, you get to 10 or 11 years, and you've seen it all, you've done it all, most of the time. If you're doing a lot of courses, and so you've got the time, just keep going.
Yeah. Fair enough. So, I mean, you're saying that a lot of the times, in terms of difficulties, it's how best to kind of get through it is just persevere to the end, but make sure you've got that kind of backing to make sure you can get yourself out of those sticky situations. And then, is that what you're saying?
Yeah. I mean, look, if you absolutely hate it, I'm not saying to do anything you hate, but if I'm undecided on a particular, I guess, facet of dentistry, I'll follow it through if I've dedicated myself to a course and do it properly. Do a longer course, do a longer modular course, and then from there, once I've come out of that course with all that information, have the backing in order to avoid any issues as I embark on some new dentistry. Yeah.
I think an interesting point you also pointed out was the fact that having that support network that you can kind of go back to. A lot of times people do CPD and they kind of get this case that comes up, and they may not have that kind of mentor that can support them, but because they've done the course, they feel like they're a little bit more ready. But then obviously, like you said, there's a few challenges along the way, but if the course provides that support, then you can still go back to them to kind of build on that and be a bit more comfortable. So that is interesting.
Yeah.
So what's your current ideal clinical day look like? The type of procedures you might be getting up to.
So at the moment, my current clinical day is usually surgery in the morning, or say a full arch of crowns. So I tend to do my bigger cases in the morning, and then in the afternoons, some reviews. So from after about lunch to halfway through the day, I do my reviews, and then at the end of the day, I leave that for consults. A lot of the patients that come in for the bigger treatment and things like that are working, so it's easier for them to come off and do the consults in the afternoon after work. So it just makes, and then, if they're booked in for treatment, they usually take the day off. So I go surgery or big crown cases, and then, that's pretty much how my day goes.
Yeah. And then you mentioned you also did some GA as well. Is that something that you want to introduce a little bit more, or is that only for particular cases?
That's a difficult question. I actually have this conversation with my patients all the time. I mean, GA is great for surgery and things like that. When you get patients that know you do GA and they want to do a clean under general anesthetics, it's a nightmare. I mean, I just can't justify it. But a lot of the time, I mean, what are you going to do? Some patients just refuse to. I do in-house sedation with a anaesthetist, but some patients want to do cleans under GA, believe it or not. And
wow.
They refuse, and sometimes they just got no one else to go to. So I've done that. Look, my equipment at the practices, obviously, both the practices are brand new. So, the electric motors and things like that for crown preps and stuff like that, it takes me a couple of seconds. Whereas when I'm in theatre, we've got this little dingy cart, which is is a real pain to cut a crown with. I mean, it takes me about 10 times longer to do it. So I try to steer my patients off doing crowns and things like that as well, or fillings. I mean, it's tough, but the surgery and the full arch stuff every day of the week. Having a patient asleep completely in a coma gives you a chance. I mean, when you're doing a full arch of surgery, sometimes these things can take you 5 or 6 hours. It's taxing, right? So you want to be able to take a break halfway through and just stop and take your gloves off. And usually in practice, if the patient was awake, they'd be like, what the hell are you doing? But when they're asleep, it makes no difference to anyone. So it's, that's been really good.
Because you've accounted for it, yeah. So share with us what your ideal clinical and non-clinical day might look like in 5 years' time, and what kind of CPD do you want to do to kind of get to that point, or CPD that you might be interested in?
Yeah, look, I can't wait for the borders to open. Obviously, there's a lot of courses that I want to do overseas, a few occlusion courses that I'd like to do. I'd like to do some PCOS courses as well. Maybe I'm not that interested in doing zygomas, but I'd like to learn a little bit more about zygomas and implants like that.
So what kind of... Sorry, continue.
And I just want to travel and do courses. There's something really fun about being overseas and doing a course with other dentists. For me, yes, it's a course, but it's still a holiday. So it gives it that, it's a lot more fun that way. My typical clinical day, I hope in 5 years, I mean, I'm pretty happy with what I'm doing at the moment, to be completely honest. I don't think I'd change too much. I'd probably want to be mentoring a little bit more. So just helping my associates and working with associates and probably teaching them a little bit more if I can. Maybe take a day off instead of working 6 days a week.
That's a lot. I mean, 6 days a week for what you're at this stage, that's a lot of work. So tell me about those occlusion courses that you were mentioning. What courses are you thinking about?
There's a fucking the Panky course. There's a couple of courses in the States. I've lost the name of the other one, but
was it Coice or Spear?
The Coice course. Those are the courses that I'd like to go over and have a look at doing. I mean, occlusion's such a topic, right? I mean, everyone's got their 2 cents about it, and I think I'm at the stage. I love doing these courses. So and like I said, I love traveling. So if that's an excuse, then I'll take it. So I probably will end up doing as many as I can, and just formulating my own opinion on these things.
Yeah. I mean, you have flying lessons too, right? You like to...
Yeah. So I was supposed to get my recreational pilot's license just before COVID struck. So I've done about 60, 70 hours of flying, and I was actually studying for my theory exam and my final practical before I get my license. And it COVID struck. So, and that's the second time it's done it to me. But there's a couple of planes that myself and my partner own that are in the hangar, which I can't fly at the moment, which absolutely sucks. But the time will come.
You'll have to find some time within your busy schedule, hey? Yeah. When COVID's post-COVID.
Yeah.
So just to wrap it all up, is there anything that you would like any words of wisdom you want to give to the young budding dentist that is looking to kind of follow your career path?
It can be a lonely job. I find these WhatsApp groups, they're probably the best thing. You can't underrate these groups. Being a part of a group with other dentists and talking about your cases is super important. Because it is a lonely and sometimes thankless job. So being surrounded by other dentists is super important, and constant communication is super important. And trying things out, because there's no right or wrong answer when you're learning, right? If anyone ever needs any guidance, I'm here, and they can definitely reach out. I was always blessed with a really good, just fell into them, support network in whatever aspect I was in. And I'd like to be a part of someone else's solution. So whether it be the Australian Dental and Implant Group or the Australasian Implant Academy, learning how to place implants, just reach out, and I'd be more than happy to help guide.
So David Bassal, thank you for coming on the show today. Let the people know how they can reach you and what's kind of going on in your life.
How they can reach out to me through email, I can hand it over to you, or on my Instagram, if you can just shoot me a message, Dr David Bassal.
No worries, we'll definitely leave it in the show notes. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie Podcast. Thank you.
Thanks.